What's up everyone? Mike Taylor, student physical therapist, here today to talk to you about how you can treat your low back pain with exercises and principles outlined in the specific exercise treatment-based classification. So you can learn a little bit about the treatment-based classifications in my video that I did on the treatment-based classifications, which I'll link in the description box below. But for this video, we'll just do a quick refresher on the criteria for the specific exercise group. And those criteria are: these people are going to have pain extending into the leg below the level of the butt. They're going to have pain that gets relieved with one motion, so either flexion or extension usually. And that pain is going to get worse usually with movement in the opposite direction. And for patients who meet those criteria, our treatment option is a lot of repetition in that relieving pattern. So what exactly do I mean when I talk about specific exercise? This was a concept that was made popular by the McKinsey method, which is quite a bit more complex than what we'll be discussing today. And what I really intend to do today is just to give a 1,000-foot overview or summary of the system as a whole, but that should be enough to get you on the way to doing some good things with it. But essentially, specific exercise, or mechanical diagnosis and treatment as it's sometimes referred to as well, is a comprehensive diagnostic and treatment-based paradigm in which postures and movements and a patient's responses to both of these are assessed and incorporated into a treatment plan to help decrease pain and improve function. So the overriding premise behind specific exercise is that patients with low back pain, especially pain that goes below the level of the butt into the leg, is oftentimes relieved by repeated motion into either flexion or extension and then made worse with the opposite motion. So people overall tend to have a tendency to prefer flexion or extension depending on the type of pain that they're having. So for physical therapists looking for treatment options, this is crucial because we can really harness that preference and just go to town with repetition after repetition of that preferred movement. There's a little bit more terminology that I need to clear up, so bear with me here. And the first term we'll discuss is called a directional preference. And that's basically what I just discussed already, and that is some people will tend to prefer either flexion or extension. So people who like to sit down and that makes their back feel better are going to have a directional preference into flexion, whereas people who prefer standing, where they're a little more extended, are going to be more extended. And so this is just in reference to the quality or amount of pain they're feeling in their back. It's important to know someone's directional preference because that directional preference is usually the direction that we're going to work into to achieve a phenomenon that's called centralization. And so centralization is different than a directional preference. What we're looking for with centralization is that radiating pain into the leg to centralize or come up the leg with repeated motions or extended time in a certain posture. And so one thing that's important to note that's a difference is you might have centralization without experiencing a relief of pain, and that's okay. Sometimes pain will actually increase in the back as the pain recedes from the leg, and that is correlated still with good outcomes overall. And given that we can't talk about one without the other, if you have centralization with one movement, you can oftentimes have what's called peripheralization with another, and that is exactly the opposite, in which the pain goes further into the leg. So that's what we're trying to avoid if possible. So the terminology is important because centralization is going to be the thing that we're looking for to guide our treatment, not what you tend to prefer, but what causes you to centralize. So that's the big thing to keep in mind throughout the treatment process that I'm going to go over next. So the first step in your assessment is to take a careful note of what your baseline pain is like. Take note of the rating of how much pain you're in addition to noting how far down your leg, if at all, you are feeling pain. That's very important as it will guide our treatment going forward. So the first thing you're going to do is you're just going to lay flat on your stomach for 1 to 3 minutes. And so, if you can't tolerate laying flat on your stomach, what you can do is you can grab a pillow and put it beneath your hips. You can stack up as many pillows as you need. And so you're going to lay flat on your stomach for 1 to 3 minutes. If you're using pillows, slowly start removing them as you can tolerate until you're laying flat on the floor. So once you've been laying flat on your stomach for 1 to 3 minutes, take note of how you feel. Did the back pain change? Did the location of pain change in your leg? What you'll do next is you're going to do 3 to 5 sets of 10 to 15 prone press-ups, and I'll demonstrate. So you'll be laying on your stomach first. You're going to prop up onto your elbows. Nice and gentle. And so you might experience pain as you're doing this, and that's okay. What I encourage you to do is to only do as much motion as you can tolerate, but also don't stop just because you're having pain. That's sometimes an expected outcome here. Trust the process and go through with it all. So if you can come up onto your elbows, do that. If you can come up onto your hands, you can do that. It's going to be all guided by you. All right, so let's say you've done 3 sets of 10. You can then take note of how you're feeling again. And so what you'll decide then is if you're feeling any pain going up or down the leg. And it might take multiple attempts at this. You might have to do another couple times doing 3 sets of 10 to really notice a change. If you still aren't having any luck identifying any change or directional preference or centralization with the extensions, what you can do is you can try offsetting your hips to one side. So to do this, you can bring one leg up like this, and then try doing it again here. And so that's going to preferentially close down one side versus the other and just kind of change the whole dynamic of the movement. You can try it on your left. You can try it on your right as well. And so let's say you do some extensions and you know what? The pain that was previously in my calf is now in my thigh. That's a good sign. And so right now we can be thinking, okay, so centralization was achieved with extension. So what you do then is you work into extension a lot. Just like with any other exercise program you're doing, the key to getting this to progress is going to be by increasing the amount that you're doing it and increasing the intensity that you're doing it with. So what I want you to do is every hour on the hour that you're awake, you're going to be doing sets of 10, 3 sets of 10. So lay down. If at first you're only able to come up this high, I want you to eventually try to progress to coming up onto your hands. You want to think about kind of peeling yourself off the table like a banana peel. You don't want your hips to be coming off like that. Once that gets too easy, you can get that same pillow we were using before. You can roll that up, put it beneath your feet here, and then come up. And that's going to further increase the intensity of the extension you're getting. Finally, you get up to the top, take a nice exhale. Let yourself sink into that end of motion there, and then back down. As you sink, you'll relax. You get slightly more extension there at the lumbar spine. The big thing here is that you need to continue doing it until the pain has centralized completely into your low back and then more or less gone away. Like I said earlier, you might experience pain increasing in the back as the pain leaves the leg, and that is perfectly all right as long as the pain is leaving the leg. We are going the direction we want to go. So let's say you ran through that whole process and it did absolutely nothing for you. If anything, maybe you even felt the pain go further down the leg and you felt worse. So what you do in that case is you try it again, but this time with flexion. And to do that, you'll just go through the same process. So you'll lay down, this time on your back. And we're gonna do some knees to chest. 3 sets of 10 to 15, even if it's painful. You can try offsetting your hips slightly, so you can kind of go off to the side. And so then you'll take note of how you feel. If you feel the pain coming up the leg, good. That just means we then need to continue with that movement pattern into flexion. So then you progress the amount that you're doing. So you can continue doing knees to chest until you're good with that. And then you can gradually start doing stuff like bending forward while sitting. And then finally, bending forward, standing up to get the most flexion possible. Same rules apply. Let centralization be the guide. So for most people, extension is going to be the directional preference and the centralizing motion. And the reason for that is that characteristic pain down the leg is commonly provoked by a discogenic pathology or pain in which, say, you have like a posterior disc herniation. It can sometimes impinge on the nerve root, leaving the spine, going down the leg there. So that can be sometimes a cause for pain. And so what we know about discs and how they heal is that they resorb. So if you have a disc bulge or a herniation, over time, it can resorb and go back. in theory, what we're doing with this repeated motion here is we're kind of helping to milk that disc back the way it came. But what about the flexion group? So I know for a fact I've seen people who have pain down the leg and it was relieved with flexion. And so that doesn't make a lot of sense, especially, sometimes, sure, discs can bulge anteriorly, but they're not going to be hitting any nerve roots like that. And so my thought process on this is, yes, we might be doing some mechanical work on the discs itself. However, I think what we're really working on here is just kind of reacclimating the body to ranges of motion that were previously provocative and kind of put us on high alert and increased our pain and irritability. So by working into those ranges of motion gradually that we previously would not have been touching, we're kind of helping to turn down our irritability with our pain in general to the point that we're bringing it back up until it finally goes away. So pain is kind of like a mysterious and confusing thing sometimes, but I think there's more to it than working the disc back into its original place. So there you have it, guys. This has been a very brief and condensed overview and summary of the system as a whole. And if you have further questions, I would highly recommend seeking out a physical therapist who is certified in the McKinsey method, as they can be a really valuable resource if you want to go this route in treating your back pain. But this is a good place to start, so I wish you the best of luck and happy training.